Good morning, everybody, and welcome to the 2021 North Country Leadership Summit, Emerging from a Year of Change, an opportunity to rebuild and reimagine. This conference is being put on by Adirondack Health Institute and Fort Drum Regional Health Planning Organization. My name is Nancy Del Mastro, and I am the Telehealth Project Manager at AHI. We want to give a quick shout out to all of our sponsors for this year's conference. Thank you for all of your continued support and all the support over the years. We couldn't have this conference without you. Before turning it over to our presenter, we wanted to give a couple housekeeping items. Please place any questions and comments in the chat, and we will ensure that they are all answered, and we will be having a Q&A session after the presentation. All attendees, please stay muted with your video off to ensure that the best broadband connectivity is possible and there's no distractions. And all presentations are being recorded and they will be archived on the North Country Leadership Summit webpage by October 1st. That being said, I'm going to turn it over to Andrew Solomon of the Northeast Telehealth Resource Center to give a presentation entitled Telehealth in 2022, a focus on patient engagement and quality improvement. Take it away, Andrew.
Thank you so much, Nancy, and good morning, everybody. Thanks so much for joining us today. As mentioned, my name is Andrew Solomon. I'm the Senior Program Manager for the Northeast Telehealth Resource Center. I recognize a few names on here today, so great to see you all, but also great to see many new names as well. So I'm going to dig into a little bit about what the Northeast Telehealth Resource Center is, and then talk a little bit about this pivot moment that we're at in telehealth and some of the opportunities looking ahead. I hope to save some time at the end for questions and discussion, so welcome that as we go along or once we get to the end of the slides. So if you're not familiar, the Northeast Telehealth Resource Center is federally funded through the Health Resources and Services Administration. HRSA has funded the National Telehealth Resource Center program for over a decade. I'm based at a global public health institute called Medical Care Development, headquartered in Maine. We have a variety of different grant-funded public health and healthcare delivery improvement programs around the world. We have clean water and malaria control initiatives in Africa and other areas, but we also do a lot of work domestically around healthcare improvement. On the Northeast Telehealth Resource Center, we've also partnered for the last 10 years with the University of Vermont and the University of Vermont Health Network, but have been really excited to work with organizations all around New England, New York, and New Jersey for the last 10 years. We always do give the disclosure and acknowledgement that any information provided by Netric is for educational purposes only and should not be regarded as legal advice. I'm not an attorney, and neither Netric or myself have any financial interest arrangements or affiliations with any organizations related to commercial products or services that we might discuss in this webinar or throughout our work. The federally funded telehealth resource centers provide technical assistance and education around telehealth program development and really more so today, optimization. So we're available to answer any questions around telehealth that you might have. You can reach out through our website or you can reach out through the AHI team, maybe even better. We do have example telehealth policies and workflows. We track policy, legal, and regulatory factors very closely. We do help with technology assessments. Because we're federally funded, we are vendor agnostic, so we try not to recommend any one solution, but help you think through the considerations and the options. We are fortunate to be part of a national telehealth resource center network. As I mentioned, around the country, there are 12 regional resource centers, and together we cover all 50 states. The Northeast TRC covers New England and New York. We also have two national centers. One is the Center for Connected Health Policy. They help us track all of the policy and regulation related to telehealth. If you have not seen their website before, cchpca.org, they have a really great library of resources and a really great legislation and policy tracker. We also have the National Telehealth Technology Assessment Center based in Alaska, and they help us track the sort of evolving telehealth technology landscape. And they do a lot of testing and assessments of the different technologies. So beginning to think about how telehealth is going to look as we move into 2022 and beyond. Broadly, the way we've always looked at telehealth is it's the provision of healthcare, public health, and health education at a distance using telecommunications technologies. There's still a big question about whether telephone is included in telehealth, and we're seeing many states are including telephone in their telehealth policies. but there's certainly a number of conversations ongoing. And in general, as I'm sure many of you are familiar with, there's a number of ongoing conversations about what will policies look like after all of the public health emergencies have ended. When we work in telehealth, we do include live video or synchronous modalities, store and forward or asynchronous modalities, and remote patient monitoring, which I'll touch on a little bit as evolving strategies for the future, if you're not doing it already. And we also always like to highlight that in general, we don't consider telehealth a service or medical specialty, but a tool used to deliver care. And the New York State Department of Health has also agreed with this, that telehealth is really a tool to help enable access to the same standard of care that we would have in person. Over the last 5 or more years, we've seen a variety of different drivers and barriers to telehealth adoption. And I'm sure many of you on this call today have experienced some of these. We like to say that one of the big drivers in telehealth is access. How can we enable more immediate and more convenient, better fitting access to patients when and where they need it? There's certainly a lot of drivers around consumer demand and this evolution of direct-to-consumer services and services offered by other maybe organizations that we wouldn't consider our traditionally healthcare providers, like large box stores and similar. We've seen provider shortages drive telehealth. How can we increase access to specialty services and distribute specialty services over larger geographic areas using technology? What are some of the competitive forces driving organizations to telehealth? It may be the consumer demand. It may be these new organizations that are now competing with what we might say are more traditional healthcare providers. And I think payment reform is going to continue to be a major driver in telehealth as we continue to move towards sort of a value-based care structure, and organizations, healthcare providers are required to maybe track total cost of care and track access or clinical outcomes that are related or maybe driven by access. How can we leverage telehealth to help improve those? I'm sure many of us are familiar with the barriers that still exist for telehealth adoption. Those could include cost of technology, access to technology, availability of broadband, especially for the consumer. Licensure barriers. In general, it is recognized that the clinician needs to be licensed in the state where the patient or client is at the time of service. There may be some privacy and security concerns, maybe more so from consumers. Perhaps a resistance to change. Often telehealth does require a slightly different workflow, and depending on how it's implemented and integrated into existing workflows, it may create a little bit more work to connect. And what sort of barrier does that create for the care team and maybe for consumers? We'll talk about this a little bit more, but digital literacy and training for everybody involved in a telehealth workflow. Is everybody prepared to access the technology? And if not, how can we provide the appropriate support to enable that access? And then there's some pending legal and regulatory questions. I think this area has gotten a little easier over the last 5 years now, that as states and the federal government has continued to clarify legal and regulatory requirements for telehealth. But there certainly are some potential barriers created by those regulations and some things that maybe we're still waiting to be defined. For example, we still get a lot of questions about the Medicare policy post the federal public health emergency. And will the Medicare policy cover telehealth when it's not provided in a rural area? And the answer is Medicare can't until Congress makes a change. And we can talk about that more as well. In response to the COVID-19 pandemic, we really saw this major shift, and I'm sure many of you experienced this, of moving telehealth to the home. How can we connect with clients and patients directly in their home through telehealth? Traditionally, telehealth was always sort of designed around that hub and spoke model, where a patient or client was at a healthcare facility connecting with that other healthcare facility. But as we look towards 2022 and continue to work on creating and optimizing these programs for connecting to the patient wherever they're located, there are a number of new factors, or new at least in the last 1 to 2 years, that we still really need to work on. From the patient's perspective, digital literacy. Are we able to provide support for patients to learn how to access the visit through telehealth? Is there technology support, both for the actual device and having availability of the device, but also technical support when there is a challenge in making the connection? How do we integrate things like interpretive services and supports for disabilities? I'll touch on that a little bit more in a couple of slides, but it's really essential that we have those same services available through telehealth as we would in person. And there are some reasonably simple workflows to be able to integrate on-demand interpreting services, but we do need to plan ahead to be able to enable that. For providers, what are we doing around provider and staff training? For the full spectrum, technical training on how to access the technology, but also training on how to ensure quality in telehealth and equity in telehealth. I'll talk a little bit more about that in a little bit. What are the legal and regulatory considerations that providers need to be aware of? Again, licensing barriers. We still every day nearly we get questions from a variety of different providers about whether they can connect with a patient who's in a different state. And so there's a lot of questions still remain about that, and I think certainly a lot of discussion we can have about that. And then for everybody, again, are we designing telehealth so that it's easy to use, or how can we better design telehealth so that it's easy to use? How can we improve access to technology and access to broadband? And how can we ensure the continuity of care and access to patient medical records, sort of regardless of the way we're designing telehealth, whether it's an on-demand urgent care system or integrated into maybe your health system. Now, we've seen a lot of really cool use cases in telehealth across the region. And again, when I say the region, I think about New York and New England most notably. But there's a lot of really innovative ways to incorporate technology, really focused, I think, on enabling and improving access to care. One sort of a neat example I like to bring up, so I am connecting with you today from coastal Maine, and this is a model that we've shared a number of times, and many of you may have seen this before. This is the Maine Seacoast mission up in Bar Harbor. They, for over 15 years, they've used telehealth on a boat, and they have a boat called the Sunbeam at docks in Northwest Harbor, Maine, and they take that out to the islands and connect to the docks on the islands and connect to internet there on the islands. And the patients or clients come onto the boat, and there's a nurse on the boat, and she facilitates the telehealth appointments with providers on the mainland. And they've been doing this for many years. And it's really sort of I think a foundational concept in telehealth and how we can create that technology link to improve access. Where in this example on the islands, there really is no access otherwise, unless folks leave the island to seek care, which can take a day or more once you leave the island, get to your appointment. And then if you miss the ferry, you may have to wait another day before you can get back. But as we look forward to 2022 and beyond, how can we use this concept about sort of bridging islands in a way where access doesn't exist or access isn't designed in a way that meets patients' needs? How can we do that using telehealth? But maybe more importantly, how can we do that to ensure that telehealth, that is a quality visit? So as I mentioned, there's a variety of different trends we've been seeing over the last 1 to 2 years around those components for integrating and improving access. One of the program trends that we've seen evolve a little bit more in the last 2 years is electronic consultations, or EConsults. I don't know if anybody on the call might be using these yet. We've seen growing interest in Maine around EConsults, which is essentially an asynchronous or not in real-time communication, provider-to-provider communication. So creating a link between a provider, maybe a primary care provider, and maybe a specialist, where the primary care provider can send a consultation with maybe pictures and additional information about the patient, and the specialist can then respond to that with a recommendation. And that recommendation may be a guidance for treatment. It may be a recommendation for that patient to come see the specialist in person. And that may be a recommendation that the patient needs to see the specialist urgently, and the specialist can then schedule that in a way that the patient can get in as quick as possible. We've seen some growing interest in Maine around an e-consult network where organizations can work together to create a network of specialists and sort of share the specialist capacity with primary care. This is a model that is reimbursable depending on the state that you're located in, but we've certainly seen growing interest in using this model. It is also reimbursable through Medicare with patient consent. Another sort of program trend that we're hearing more and more about, and I suspect many of you have heard about, is the chronic care management program offered through CMS through Medicare. The CCM program is reimbursing care coordination services done outside the regular office visit. If you're a provider organization and you're not already doing CCM, I really encourage you to look at it. We have a consultant who works with us, and she describes it as getting paid for stuff that staff is already doing. So chances are you are already doing these coordination services, but this is an opportunity to reimburse for it or to bill for it. And related to chronic care management, we also have seen an increase, and I know many of you, or sadly some of you, are involved in remote patient monitoring programs in the North Country, but we continue to see growing interest in how to leverage RPM or remote patient monitoring programs to engage patients with chronic conditions. Remote patient monitoring, if you're not familiar, are the devices where we can send to the patient's home maybe a little tablet that's connected through a cellular connection with a scale, blood pressure cuff, maybe a pulse oximeter, and a software that will direct the patient to take those vitals maybe twice a day. On the back end, there's probably an algorithm that's based on the patient's needs and designed by the care team that will say if the blood pressure goes over a certain number, or if weight goes over a certain number or under a certain number, there will be a flag sent back to maybe a nurse case manager or care manager who can then contact that patient and interact with that patient, engage that patient immediately, and maybe get them into onto a virtual visit or maybe an in-person visit if needed. A lot of these trends, I think, were well captured in the Reimagined Commission report that was published March of this year. So the state of New York brought together the Reimagined Commission to look at a few different things, including telehealth. And the group identified 3 objectives for telehealth in the state of New York, including enacting policy reform, encouraging payers to develop more extensive coverage and reimbursement for telehealth across all insurance types, which I think is no surprise. But objective 2, empowering patients with the connectivity, devices, private spaces, and familiarity to take full advantage of telehealth. And ignore that typo, please. And then objective 3, equip health and behavioral healthcare providers with the appropriate training, resources, and tools to deliver high quality healthcare. I think these are 3 essential goals as we move to 2022. I'd like to try and bundle some of those into thinking about quality improvement in telehealth. So as we move ahead, how can we ensure that we are optimizing our telehealth workflows to ensure quality, both the quality visits, but maybe also how do we incorporate it into our quality metrics in our overall quality improvement work? So as we think about the Reimagined Commission report and sort of this idea of quality, what's included in telehealth quality? And I'd welcome feedback on this. Some of the quick things I wrote down, and I've heard from some others, might include anything ranging from sort of etiquette and professionalism from the care team when they're on with a patient, the appropriateness of the application being used for telehealth, and is telehealth appropriate for that service, or does it really need an in-person encounter? Does the telehealth service have access to the patient's medical records? Is the care team or the clinician on the call proficient in taking history and performing an appropriate physical exam through virtual technologies? And that may mean, do we have the adequate technology quality and adequate technology peripheral devices to do the physical exam? And a peripheral device would be maybe an exam camera, an external camera to allow better imaging of maybe something on the skin. It could include a digital otoscope, so we can look in the ear and have a proper image of the ear for diagnosing maybe an ear infection from a distance. Quality might include privacy and consent considerations. Do we have a proper patient consent workflows in place before the telehealth visit? Quality might include accessibility considerations. And do we have interpretive services and other accessibility considerations properly integrated into our system that are easy to access? The Northeast TRC has been working on some efforts to improve provider training, and I'll talk a little bit more about that in a few slides. We also welcome feedback. We do have some funding to create some additional training resources, and we'll welcome feedback and input on how can we best work with organizations across the North Country, but also across New York and New England to help create some additional sort of virtual training programs, depending on what's needed. We get a lot of questions around sort of what is required to start a visit. Some of these tips have been integrated into training programs for clinical students. So our providers, when they join a visit, or maybe somebody on the care team doing things like checking the technology to make sure the audio and video works for both the patient and the provider side. Is the provider reviewing their name and credentials with the patient? Is the patient in a private, comfortable location? Is the care team or the provider watching to see if maybe there's a change in the patient's behavior that might indicate somebody has entered the room that maybe they don't want to be there, or the room is no longer private? How are we confirming the patient's identity? Are we reviewing the purpose of the telehealth visit and sort of confirming patient consent if we haven't done that already, maybe written through an electronic means? Really important, and I don't know that many organizations have effectively integrated this into their workflow. Are we confirming the patient's backup contact information? And do we have emergency procedures in place should the patient become unresponsive on their side? And if the provider needed to call 911 to send emergency services to the patient's home, for example, do we have the contact information? Do we have their address? And are we prepared for the workflow? In the sense that if the provider is not in the same 911 dispatch district as the patient, my understanding is that 911 dispatch will then have to sort of manually reroute the call to the right location. And have we sort of worked through that process to be prepared for what that might mean and the time delay that will create? For providers on your team, if you're looking for physical exam resources, here are a few quick, really nice videos around how to do a physical exam through telehealth. We are working on creating a new online training around physical exams. If this is something of interest to you, love to discuss further. One organization that has been spending a lot of time on this is Maine Health, and they are working on creating a open access virtual training for providers on physical exam best practices through telehealth. We also are going to launch a new initiative that we're calling the Telehealth Quality Initiative. To better understand sort of what is telehealth quality, that list I presented 2 or 3 slides ago, is that comprehensive? Do we include all those in sort of what we might consider as telehealth quality? What are quality best practices, and what resources can we collaboratively create to help improve and maintain telehealth quality? So our goals are to work with individuals around the region, and if you're interested in this, would love to discuss further. To better define as a region what is telehealth quality and what is the scope for primary care and behavioral health most notably, but happy to discuss that as well. How can we sort of work together to establish a regional learning collaborative to identify the telehealth quality best practices? And can we use our HRSA funding to create an effective online e-learning program, maybe with certificates in CME, to help care teams learn more about telehealth quality and sort of overall improve quality in telehealth? If that's of interest, would love to discuss further with you. But telehealth quality isn't the only component in the conversation. Equity is also, and maybe even more so, essential in our conversation. How can we better address health equity through telehealth? And how can we ensure equitable access to care when using telehealth? Some of those factors might include, again, staff training and awareness, both about how to help patients access telehealth, but how can we identify patients who may benefit from telehealth who aren't already accessing it because maybe they don't have equitable access to technology? So do patients have access to broadband and technology? And what is the role of healthcare in helping patients gain that access? Are we able to provide support to patients for digital literacy? And are we, again, I've reiterated this a couple of times, are we designing our programs to be equitable in the sense that they are accessible and they have services like interpreting integrated into the workflow? And how can we use data to leverage, how can we leverage data to make sure that we are designing a program that is equitable? And can we look at our patient population and ensure that we don't have any biases in the way that we're delivering telehealth to our patient population? But can we also use data to identify which patients may need telehealth, and how can we help them make that connection? So for example, so social determinants of health, I'm sure most folks are familiar with this, but SDOH, or social determinants of health, are the conditions and the environment in which people are born, live, learn, work, play, worship, and are age that affect a wide range of health functioning and quality of life outcomes and risks. So if you've integrated a social determinant of health screening in your program, or you're screening patients for social determinants of health, which might include the availability of resources to meet daily needs like safe housing, food, access to healthcare services, transportation. Is transportation a barrier to healthcare? availability of community-based resources, and language and literacy, and many more beyond this list. If you're not screening for SDOH already, strongly encourage you to look into that. But if you are screening for social determinants of health, do we have a system where we can present that information maybe to the call center? And if the patient has previously screened positive for transportation as a barrier to healthcare, is there ways that we can help ensure that if transportation is a barrier, that telehealth may be an option when it's appropriate to offer to that patient to make access to care more convenient? And how can we design the system so that we can present that information, or our systems so that we can present that information to the right people who are helping the patient navigate the system? This is a slide I borrowed from a national webinar that was presented probably almost a year ago through the U.S. Department of Justice. The U.S. Department of Justice presented a webinar for the National Consortium of Telehealth Resource Centers. And the theme on the webinar series was sort of hacks to telemedicine or telehealth. And they presented this slide for hacks for accessible telemedicine, which I think is really important to highlight. And they said, as you invest in permanent changes to include telemedicine in your practice, or to improve telemedicine in your practice, I might add, consider using a telemedicine platform that has the capacity to add third party, for example, an interpreter service for someone who is deaf, or a remote care provider for a patient with intellectual disabilities. They also said, consider reasonably modifying your pre-telemedicine appointment practice to allow for additional time to provide a patient with a visual or intellectual disability extra assistance with using the video platform technology. And I think that in this webinar, the U.S. Department of Justice made it pretty clear that this is also on their radar, the disability rights section, that we need to make to ensure that the healthcare is accessible to everyone in person, but we need to do the same thing for telehealth. And I think in many ways, as we look to optimize telehealth, I don't know that we've done a great job at this yet, but I think as we move forward, it can certainly be a top priority. So I have a few more slides, and then we can dig into some discussion and questions. I did want to mention the Northeast TRC. If you're interested in an additional conference, we are hosting our regional annual conference actually next week, September 23 and 24 in Manchester, New Hampshire. We are offering it both in person and virtually this year. So if you're interested in taking a look at our agenda, all the information is on conference.netrc.org. We do have sort of a mix of presenters who are planning to present in person, but also some who will be presenting virtually. This is our sort of keynote lineup. We have a variety of both regional providers and also national speakers who will be speaking. If you're not familiar with him, the far right, Dr. Nundy recently published a book on care after COVID, and I'm really excited for his presentation, sort of looking at the healthcare system broadly and how can we better design the system based on what we learned during the pandemic. Through the Reimagined New York Commission and through some additional funding the Telehealth Resource Center received through the CARES Act, we have been building 2 online training programs. One is nytelehealth.metric.org. This was designed with several collaborators on this call, but also the Reimagined New York. It was endorsed by the Reimagined New York and supported by Stony Brook Medicine. It's an open access portal that anybody can access. We do ask for registration just so we can track utilization and report broad utilization numbers back to HRSA, our funders. But it has a variety of different online training programs that are available, including sort of an introduction to telehealth module series, a module series that Stony Brook Medicine created around interprofessional telehealth. It's an 8-part series. I really highly recommend that. We have a session that we are in the process of updating with the New York State Department of Health around the DOH and other state agency regulations related to telehealth. And then we also are publishing, just released a new module on telehealth for community health workers. It's a 90-minute module designed for community health workers on sort of what is telehealth, but also how community health workers can integrate some of their day-to-day skills into a technology or a telehealth workflow and help improve access to telehealth for their clients. Similar to the New York portal, we've also created a telehealthclassroom.org, sort of geared towards the rest of the region we serve, New England. We are working on merging these so you can sort of go back and forth between each of these. but telehealthclassroom.org has similar modules to the New York portal. We also have on Telehealth Classroom an introduction to telehealth for primary care, and we are just about to release a telehealth toolkit, or a toolkit on integrating EConsults programs into your work. So we're going to make all modules available regardless of how you access the portals, but either nytelehealth.netrc.org or telehealthclassroom.org. And again, both of these are created through federal funding, so they are open access. We do ask for registration just for tracking, but we also do have additional funding to work with organizations to design and publish additional trainings. So if you see a need within your organization for training, we'd love to discuss further. In addition to publishing on these portals and making them open access, we have explored with a few organizations how we can export the training modules so that you can import it directly into your internal learning management system, if you have one of those. So if that's of interest, happy to discuss that. We really want to serve as a resource, both for technical assistance, sort of day-to-day, what are your questions, but how can we help you create training programs and enhance staff training within your networks. So as I mentioned, just released on the portals is Telehealth Basics for Community Health Workers. And this is a 90-minute course. We had input from over 300 community health workers from around the country, working with our fiscal agent medical care development, which had existing community health worker training resources. We sent out a survey with 300 responses, and then we also worked very closely with the Rhode Island Community Health Worker Association, who provided continuing education credits for community health workers who took the course and provided additional feedback. So this was just released. If you have a community health worker team, really strongly encourage you to check this out. Happy to provide more information if it's of interest. And a few additional resources for patients and consumers. These are all sort of open access resources that you can grab and add into existing training resources you might have, or provide as a handout in a couple examples. The first, what to expect from a telehealth visit, a really great YouTube that was created by the the Pacific Basin Telehealth Resource Center in Hawaii Department of Health, sort of geared towards maybe more so consumers. There's a tips for telehealth fact sheet that we created a couple of, well, probably about a year ago now. And then if you're not familiar with it already, there's a kind of a neat nonprofit that was created by students in Connecticut called Telehealth Access for Seniors. I think it's a really interesting model if you're looking at how can we better create opportunities for patients to access technology. Telehealth Access for Seniors is using a model where they are taking donated devices, refurbishing those, and then providing them to clients to access telehealth appointments. I think that's just one model to create access to technology, but kind of an interesting program. If you haven't seen them already, definitely encourage you to see how they're doing that. And a few other resources for providers that might be of interest to you, including a telehealth best practice for provider training, some sample provider tip sheets, including some of those that I outlined on the slide as far as considerations for when you start the visit, including making sure that the provider has access to the address and contact information should there be an emergency situation. And then the third bullet there, I think a really neat resource that we haven't talked about yet, empathy in virtual visits. And that was, that link will take you to a fact sheet created by the Cleveland Clinic, and thinking about how can we integrate empathy into the work that we're doing during a virtual visit for providers and care teams. So with that, I'm going to pause for a minute and see if we have any questions or discussion about that sort of very quick landscape and how we begin to think about telehealth in 2022 and beyond.
Thank you so much, Andrew. We do not have any questions in the chat as of now. Participants, I do encourage everyone to ask any questions to Andrew. He is such a great expert that we are lucky to have on the line. If there aren't any questions that come in, Andrew, if you want to discuss any of the topics you hit on in more detail, or if you want to engage the participants in any discussions, feel free.
I'm going to try and practice my my Project Echo pause just for a few seconds here to see if anybody wants to chime in, and if not, I'm going to share my screen again. And I would encourage you to again, do that through chat, or if you'd like to unmute yourself. Nancy, I believe participants do have that capability if folks would like.
Andrew, we did just get a question that came in. I'll read that for you. Do you feel the community health worker course is applicable to care managers in the community?
I think so. I guess I'd be kind of interested, Mary, and thanks for the question, to dig into a little bit more about how you define care managers, and was that sort of like a nurse case manager or care manager? I think in many ways it would, and actually a great question, because that's exactly where I was headed. So I want to give a quick demo of the Telehealth Classroom portal. And again, a lot of what I'm hoping as a follow-up to this is if there's resources that we can help create together, that we can host on this portal or our sort of mirrored New York portal, or that you can then embed into your own learning management systems. We're really interested in how we can support that over the next 6 to 8 months. So a really quick introduction. This is Telehealth Classroom. We do ask for sign-in. I'm just going to skip. We also do a little bit of reporting. I'm going to skip that. So this is once you sign into the Telehealth Classroom or the New York State portal, this is what it looks like. These are the 3 courses we have here on the Classroom. The Support for Me toolkit was actually a toolkit created in collaboration with CMS and State of Maine collaboration around utilizing telehealth for substance use disorder and opioid use disorder services. This toolkit is open access. We only are able at the moment to offer CME credit for providers in Maine due to the nature of this the funding of this program. As I mentioned, we have a telehealth for primary care toolkit, and our telehealth for community health workers toolkit is here. So Nancy, you said I was thinking health home care managers, sometimes nurses, but sure. So let me show you quickly what the telehealth for community health workers toolkit includes, and then we can see what you think. So it's a 90-minute training. It goes through what is telehealth. It outlines sort of the telehealth modalities. So the first probably 20 to 30 minutes is really an introduction to telehealth. What is telehealth? How are we using telehealth? What is store and forward telehealth versus sort of video visits, synchronous telehealth, those kind of things. And then it starts to go into a little more specifics in what a community health worker might be involved in a telehealth workflow doing their day-to-day. So looking at what is the technology and how to support telehealth readiness and what is needed to be able to make a telehealth connection, more so from the client's perspective. What are potentially the community health workers' role and implications in a telehealth workflow? And then how can community health workers leverage their existing skills to help support telehealth services? So if I start this module really quickly, I'll give you a quick view. Should take just a second to load. And then if it doesn't load, it was bad timing for my demo. So if you take a look at this left-hand, and I'm going to pause the audio. I don't know if you can hear that. Left-hand menu. So we built all of these in a platform called Articulate. It's a fairly common e-learning portal. But so we go through for this particular module, what is telehealth, as I mentioned, the different 3 sort of primary modalities in telehealth, what is included or what is required to make a technology connection, including some of the background on broadband, some of the key terms used in broadband, and what are some of the general recognized requirements to including the capacity, speed, to make sure that the connection is sufficient enough to have an uninterrupted conversation, and some troubleshooting recommendations. And we also have embedded quizzes to this module, looking at community health workers' roles, sort of ethics and responsibilities when working with clients, care coordination, how can telehealth be leveraged in care coordination, how can community health workers or related staff help engage patients in using, or clients in using telehealth, and also beginning to look at some cultural competencies. and integrating telehealth into day-to-day work. And we'll also talk a little bit about other key skills that community health workers might leverage, like motivational interviewing, the teach back method, how to practice and incorporate role playing into training, or maybe better said, incorporating role play into helping patients and clients connect to telehealth. So if a community health worker is helping a patient, or maybe maybe this might apply to sort of other support staff who are helping patients and clients connect to the service, how can we integrate practicing and role playing into that interaction to help the client or patient become more comfortable with the telehealth service? So Mary, I hope that helps answer your question a little bit. Again, this training is open access. If it's of interest to folks, we can also look at how we can export it so you can integrate it into your existing e-learning management system. Again, federally funded, so this is available, including the export at no cost. As we look at telehealth for primary care, it might take just a second for this one to load. This is a similar course outlining some of what I discussed in the introduction slides. So as we look ahead to improving and sort of optimizing telehealth in primary care, this step-by-step implementation guide looks at everything from sort of the telehealth readiness, which I suspect many of you have already sort of gone through in past years, to looking at how can we optimize our workflows, some of the telehealth coding and billing considerations, which are still evolving. How do we define team roles within our telehealth infrastructure? And then digging on into some of the special topics that we discussed for a little while, including social determinants of health and how we can leverage social determinants of health screening to improve our telehealth service. And if we're not already doing telehealth services, there is some information included in this toolkit and how to get paid for screening, depending on some state requirements, if that's of interest. In my intro slides, I also talked a little bit about chronic care management, which is the CMS Medicare program, as well as remote patient monitoring. Both of these are outlined in this toolkit. If you have not already started your chronic care management program, I'd encourage you to dig through some of the links I include on the slide, but also check out this toolkit as it walks through sort of step-by-step on how to implement a CCM program. And it has a number of resources included in that as well. So I'm going to pause there just for a second to see if there's any other questions. While I give you a second, I'm going to pull up my next resource. Okay, I'm going to share my screen again then. So as I mentioned, one of the big focuses that we see moving into 2022 for the resource centers, but I think for the telehealth industry as a whole, is the idea of quality. We have heard some feedback from our federal partners, the Health Resources and Services Administration, about maybe not refocusing our energy, but really trying to be more intentional in thinking about quality as we're designing new telehealth programs, but really working on improving telehealth for the future. So as part of that, we are launching a telehealth quality initiative. As I mentioned during the slides, we're hoping to get a better understanding from stakeholders around the region about how you would define telehealth quality, what are some of the telehealth quality best practices, and what resources can we collaboratively create to help improve training for care teams and maybe others to ensure quality telehealth. And again, that may include sort of those ideas around adequate and professionalism and during the encounter, but also some of the clinical aspects, like how to perform a proper physical exam and what sort of physical exam information can we collect and how can we best do that, and maybe when do we need to move to an in-person visits. But this may also include thinking about our quality metrics. And if we're looking at HEDIS metrics or others, how can we tie telehealth into those to ensure we don't sort of lose track of those, especially if we have patients who are mostly doing their visits through telehealth? How can we make sure that we're addressing things like important cancer screenings or similar metrics through our program design, just like we would do in person. Or for things like social determinants of health screening, if patients are only still coming to us virtually, how can we do those kind of screenings using technology? So what we really hope to do is create a new learning program that we can post on those learning portals, but also make available to download so that you can integrate those. So if anyone's interested in this, we'd love to discuss further. In addition to our conference next week, September 23 and 24, we're also going to host sort of a virtual telehealth quality symposium on November 5th at 12 p.m. So we really bring together subject matter experts to talk about these questions and how can we better define quality and how can we start to work towards ensuring that quality is part of our day-to-day telehealth work. So I'm going to stop again to see if there's any comments or questions or discussion. We're getting close to 10 minutes left. I'd really, if anybody would like to chime in, I'd be really curious to hear, are any of you, what are you doing around telehealth quality? Is that something that you've integrated into your programs already? Or do you also see this as something that we really need to look towards for the future? And I'm going to suffer through the pause just for a little bit. Oh, and Sarah did say if anybody would like to jump in, you should have the option to unmute yourself. I'll give just a second more and then I'll jump into the next topic if we don't have any discussion. So I will go ahead and share my screen again. So the other component, as we look ahead towards telehealth in 2022 and beyond, we still, as I mentioned, get a lot of questions at Telehealth Resource Center around policy considerations. There are a couple of people I see on this call who are better at discussing New York policy than I would be. I see Katie Cook on the call and would really encourage you to connect with her if you have questions around a telehealth regulation. And Katie, I don't know if you want to chime in, feel free to. But if folks aren't familiar with telehealth policy, or if you're new to telehealth, I'd really encourage you to check out the Center for Connected Health Policy website. And I mentioned this during the slides. CCHP is our federally funded telehealth policy resource center, and they help us track all of the existing and pending legislation and regulation related to telehealth. So they have both resources around sort of what is the scope of telehealth laws and regulations, and what are some of the things you should be considering, like the licensure considerations. As I mentioned, in general, clinicians need to be licensed in the state where the patient is located at the time of service. There are some exceptions. There are some interstate licensure compacts that are beginning to change some of that structure, but that's definitely something you need to look at if you're new to telehealth. Are you integrating telehealth, or has telehealth become part of your professional malpractice insurance? We get a fair number of questions from private practitioners who are looking at connecting with patients who are maybe, or clients who are maybe moving temporarily, or maybe students who have gone off to college. And not only do they need to look at licensure, but they also really need to make sure that their professional malpractice covers not only the telehealth component of their practice, but also the new state that they might be now practicing. CCHP also has this really great telehealth policy finder. We continue to see a number of efforts at the federal level around changing federal Medicare telehealth policy. As I mentioned, one of the big questions that we get is around Medicare telehealth reimbursement. The traditional, what I'll call sort of the traditional Medicare telehealth policy, is that the patient needs to be located at a rural healthcare facility at the time of service to be eligible for reimbursement. That requirement was waived during the COVID federal public health emergency. But at the moment, at least the sort of traditional definition that Medicare uses for telehealth, that will be still required once the federal public health emergency ends. And sort of the tricky thing is that is written into the Social Security Act. So it's not a policy that Medicare can change themselves. It does require Congress to change the definition within the Social Security Act. So until that happens, we likely will still see sort of that traditional, and there's a list of CPT codes that are eligible. CMS does have a really nice fact sheet that outlines this policy. Once the public health emergency ends, organizations will have to follow that regulation where the patient needs to be located at the healthcare facility, and the home will not be an eligible site. Now, there are a few exceptions. Medicare sort of got creative a couple of years ago in the way they designed some new programs around virtual visits and virtual check-ins, where they were able to craft it in a way that it doesn't follow what was traditionally defined as telehealth, and sort of that in the sense that Medicare telehealth services are services that are essentially equivalent to in-person services. But they were able to create some new sort of services that aren't equivalent to those in-person services that they were able to waive those rural facility requirements for. If you have questions about that, Medicare did recently release the physician fee schedule that is closing for comments. CCHP also does a really nice job of outlining things like physician fee schedule requirements for the next calendar year. So I'm going to pause again. We have about 8 minutes left to see if there's any questions or comments about telehealth policy or regulation as we look ahead. You guys are a quiet group today. Katie Cook, I wonder if you are online, if you'd like to. I know you've for a long time have tracked the telehealth regulation in the state, and I know this is still an area that you're active in. Would you like to mention any comments or what folks should be looking forward to in New York State? And if you're not able to unmute, totally understandable. Oh, looks like
there we go. I couldn't unmute myself and I couldn't type fast enough. Yeah, thanks for asking that question. So from the New York State perspective, for those who don't know, I'm over at the Healthcare Association of New York State now. I'm no longer with AHI. We submitted comment last week to CMS on the physician fee schedule proposed rule, and some of the things that we called out on a federal level, of course, were that Haney strongly supports an extension of telehealth services through December 31st of 2023. We also strongly advocated for and support CMS's proposal to allow for the continuation of audio-only ability for telehealth mental health services. We advocated and strongly support CMS's proposal to remove the geographic restrictions for mental health telehealth services. We did state that we do not support the change of requiring a prior office visit and additional in-person visits every 6 months for behavioral health care. And lastly, we strongly urge CMS to consider further evidence and data collection on the value of services provided virtually before requiring patients to come back in person. So that's what we've done on the federal level. On the state level, obviously we're not in a legislative session right now, so it's pretty quiet on that front. But with the start of a new year coming here pretty soon, when they get back in session, I'm sure this will be another topic of conversation, and I can, continue to update people where necessary.
Thank you, Katie, and thanks for jumping in without any notice. Appreciate that. So if folks have questions about that or anything covered, please send that in the chat. I'm going to share my screen one more time, though. So just as a reminder, and I also mentioned this during the intro slides, we are hosting our next regional virtual and in-person conference next week, the Telehealth Launch Pad, September 23 and 24. We will be in person in Maine, New Hampshire, following all social distancing guidelines. But if you're not able to make it out to New Hampshire by next week, would also encourage you, if you have time for a second virtual conference, to consider taking a look at our agenda, and we will have a full virtual experience as well. As I mentioned, we have a variety of keynote speakers. In total, we have almost 60 speakers from around the region who will be presenting some of their use cases and experiences in sort of optimizing telehealth. A really diverse agenda, folks from all over New England and New York, and a few from beyond. Really excited for it. We're expecting about 150, maybe 200 attendees. If it's of interest, I'd encourage you to go to conference.netrc.org, and I'll copy that link over to the chat. On this website, you can check out more about our agenda. You can check out more about our keynote speakers, and then the registration options are there as well. We do have one keynote speaker from New York State, Dr. Michael Hasselberg from the University of Rochester. If you're not familiar with Dr. Hasselberg, he presented at a conference we hosted in Vermont a few years ago. I actually noticed, I think a few folks on this call may have been there. But he now does some really interesting work at the University of Rochester around digital innovation and sort of helping startup companies the University of Rochester serving as sort of a test bed for some really innovative digital startups. So when he presented before, he was presenting a lot about his project EchoWork. So Dr. Hasselberg will be not only talking about some of the innovation he's helping lead, but also some of the other work that the University of Rochester has been leading around telehealth. And we only have a couple minutes left, so I will pause there one last time to see if we have any last questions, comments, or discussion. I see Kendra did mention in the chat that the New York State agencies are also commenting on the proposed CMS rule. Thank you, Kendra. And as we have a minute here, I'm just going to grab the physician fee schedule handout for you all in case you haven't looked at what that includes for calendar year 2022 just yet.
Thank you so much, Andrew. This has been a very informative session. I'm going to attribute the quiet audience to being a Monday morning, but I think everyone would agree with saying they learned a lot from this session. So we thank you again. And just to let everybody know, as we close out this session, as a reminder, the summit is a week long, and we have sessions every day, 10 a.m., 12 p.m., and 2 p.m. Our next session is at 12 p.m. today, and it is Advancing Food Insecurity Initiatives Through Community Partnerships in the Southern Adirondacks. So that one will be great, and we hope to see you there, and as well as the other presentations we have throughout the week. Thank you again, Andrew. If there's any last minute questions, we see that Andrew did put in the physician fee schedule in a YouTube link if anyone wants to grab that before we close out the session as well.
Yeah, the first link is a really nice presentation by the Center for Connected Health Policy that outlines what's proposed in this upcoming physician fee schedule. And then the second link is a fact sheet, if that's easier to access. My closing comments would be just a reminder, what we're going to be working on over the next year is really a focus on how we can best help support everybody in moving towards telehealth quality. And we still need help sort of defining that. So if folks are interested in that, we'd love to work with you. But then we'd also love to make resources available through that collaborative effort to anybody and everybody. So that if you're able to integrate that into your existing staff training programs, or send staff over to the online portal if needed to access those. We'd love to continue to sort of build the community around telehealth and continue to build those resources so we can all do telehealth maybe just a little bit better.
Wonderful. Thank you so much again, Andrew, and everyone have a great rest of your day.
Thank you all.